Hello everyone and welcome to Peasy Pharmacology. So on last video we've talked about the antihypertensive drugs and the hypertension treatment management based on the NICE guidelines. So we've seen kind of a general guidance. So if you haven't watched that video, I would recommend you to watch it. And on this video we will see that things can get a bit more complex if patients present any other diseases. So we will see that the drug choice might change slightly if we've got a patient with any other disease. So we will look in patients with hypertension together with heart failure, or if they have myocardial infarctions such as a heart attack. We'll see if the patient has got coronary artery disease, which drugs to give them, if they have diabetes, a chronic kidney problem, or if they had a stroke and they want to prevent another one. So that's the challenge. Let's go for it. So first of all, heart failure. So what is the first choice to give? It's to give ACE inhibitor and a diuretic. Why? ACE inhibitor is a cardioprotective. This is very important. So they are given to the patients with heart failure, and it's shown that the ACE inhibitors, they can revert the left ventricular dysfunction present on patients with heart failure. And also they are given a diuretic because patients with this condition tend to have a strong and severe edema. So with a potent diuretic such as furosemide, they will get rid of all the water and edema that is present, or at least they will alleviate the edema. Also, they are associated with a beta blocker. Why? Because a beta blocker will slow down our heart and will help them with a heart failure condition. And also, we know that the beta blocker can revert the left ventricular dysfunction. And last of all, aldosterone antagonists can be associated as well, so another diuretic. So why we would associate spironolactone? Because spironolactone is a potassium-sparing diuretic. So if we have a furosemide getting rid of all the water and salts, then we can get some advantage of putting them on a potassium-sparing diuretic in order to save some potassium. So it's kind of a balance that we have here when we combine them. And obviously on patients on these drugs, they should still be close monitored for their potassium levels, just to make sure they are kept under the desirable intervals. Then the another condition, myocardial infarction. So we have a patient with a heart attack. What to give them first? First of all, always give them a beta blocker, because beta blockers, they will slow down the heart and they are proven to reduce the risk of having another heart attack again. So that's the first choice. And also ACE inhibitors or ARBs, because they are shown also to be cardioprotective and they will reduce the chances of another heart attack happen again. Then, what about if we have a patient with a coronary artery disease? So first of all, what is a coronary artery disease? It's basically when our heart, the blood supply on the heart is compromised by a blockage, by a plaque. So basically the muscles in the heart, they really need a good blood supply in order to work fine, but if there is like a plaque that is formed, then the blood supply is compromised. Some parts of the muscle might die, so that's basically a coronary artery disease. And what drug choices to give them in that case? So first choice is ACE inhibitor or ARB, because again it's cardioprotective. We give them as well a beta blocker because it will slow down the heart and it will also decrease the oxygen demand in a heart that is already struggling because of the blood supply being compromised. Then if that's not enough, we can give them also a calcium channel blocker. So we have seen that there are two types of calcium channel blockers, and in the case of the coronary artery disease, we'll choose preferably a non-dihydropyridine calcium channel blocker, so Verapamil or Diltiazem, because as we've seen, they work more at the heart level. And also a diuretic can be given as well in order to decrease their blood pressure. Okay, so looking at these three heart conditions, what is common? So it's common to give them an ACE inhibitor in all of them because it's cardioprotective. and also obviously give them a beta blocker, because the beta blocker will always slow down the heart, so the myocardial function is improved and it will help the patients coping with their heart conditions. Okay, then if we've got the patient with diabetes, the first drug to give them is a ACE inhibitor or ARB. Why? Because it's cardioprotective and is nephroprotective. This is very important to keep in mind. Then, as a second drug choice, we can give them a diuretic. And why a diuretic? Basically, the thiazides, they are known to reduce the cardiovascular events risk, so they are given to patients with diabetes for that reason. And as a third drug choice, we can give them a calcium channel blocker. So there are two types again. So we tend to give them a non-dihydropyridine calcium channel blocker, Verapamil or Diltiazem, because they are known also to be protective of the kidneys. And also, alternatively, we might give them a beta blocker to slow down the heart rate and decrease the blood pressure. However, it's always good to bear in mind that patients with diabetes, the hypoglycemia can be masked by a beta blocker. Why? Hypoglycemia symptoms, they are normally palpitations and tremors, and if we give them a patient a beta blocker, then we will slow down their heart, so the palpitations and tremors, they may not be so visible in patients with hypoglycemia that present diabetes. Okay, so what is the next one? Chronic kidney disease. So, for chronic kidney disease, we give them what? ACE inhibitor or ARB. And why? Because it's nephroprotective, so this is a nice, easy one to remember. And last of all, in patients that have a stroke, for stroke prevention. So we give them preferably ACE inhibitor, because it's cardioprotective, and a diuretic, normally a thiazide diuretic. And this combination is known to reduce the incidence of strokes, especially ischemic strokes. Okay, so that's pretty much it in terms of antihypertensive drugs choice when patients get any other disease. It seems quite a lot to take in, but just as conclusion, we can see that there are things that make it easier to understand. So the main and important thing to do is to remember how the condition is, what is the condition symptoms, and how each antihypertensive drug may help with the symptoms of the condition. So we will see, for example, for the heart conditions, we always give them a beta blocker because it slows down our heart. It improves the myocardial function. And we give them to all the conditions as one of the first choices, ACE inhibitor in all of them, as you can see. And why is that? Because they are cardioprotective and they are nephroprotective. So that's a good thing to remember as well. Alright, so I hope this video helped you with your studies or with your refresh on pharmacology. As you should know, this is part of the Easy Peasy Pharmacology ebook that I wrote. So on this book I've got all this information, and the goal is like to present how the drugs work, to present it in an easy way, and also I do these videos on YouTube to complement it. So if you are interested on accessing it, I will leave the link down below so you can have a look at it, and I hope this video helped you. Thank you, see you on the next one, bye!